Hi everyone. Wanted to provide a quick update in reference to like breast reconstruction and the options that I now have and I'm leaning towards. And so I know I did the video in terms of like talking about breast or plastic surgery, breast reconstruction on the side of like either going flat or having implants done. Leaving out of that appointment, I wasn't 100% sold on the idea of having implants. Wasn't 100% comfortable with the idea of going flat either, but just with the options that I was presented at the time, I felt like I know I didn't want what was presented to me in terms of like the flap, where it would require removing or repositioning muscle to create, breast structures. I didn't want them pulling muscle from one area of my body to put it somewhere else to do a breast mold for that. And so, meeting with that plastic surgeon at the time, the first one that I've met with, was just kind of like, well, I know I don't want that based off of what he showed me. And so after watching that video, then it was like, okay, well, my option was either getting the implant done or going flat. And so having him go through that whole conversation about me being a good candidate for implants and, what it would entail, I kind of left out of there like really like on the fence about implants or going flat, because from my understanding at that point was that I would have to have surgeries later down the road to replace the implants. And that's not even counting the fact that, sometimes they just don't take well. Sometimes your body will reject it. Sometimes the silicone will leak. And so it's just all kind of other problems that can possibly come from the idea of having an implant done that I just wasn't 100% sold on. And so, yeah, I was really, really torn. And so I had the opportunity to kind of connect with my sister that has gone through this 5 years ago. I know I've mentioned her before in another video. It's not my blood sister. And I only say that for, when it comes down to genetics and dealing with the diagnosis and all of that. So I do want to make it known, like, that's not my blood sister. I don't have any blood sisters that I'm aware of. And so for genetic purposes, when you're talking about, family history and cancer, it's not my blood sister that had cancer, but my close friend, who is my sister, went through this 5 years ago. And so she was just kind of catching up with me one day and was like, okay, where are you, how are you, which direction are you going? How are you leaning? And I told her that I just wasn't 100%. I was not feeling, like I really knew what I was going to do, and I just didn't feel good about surgery and, all of that. And so she was the one that kind of really encouraged me to consider another option that I wasn't aware of at the time. Just because I really wasn't processing what all she went through and what her reconstruction decision exactly was, in terms of what it involved. Like I knew that she had a flap. And I knew that she had an implant. I remember, that part of it. So I knew she had one of each, but I assumed that her flap for some reason was, muscle or whatever. And so after talking to her, she's like, no, like my flap was muscle sparing. Like I had to find a microsurgeon and, it's a very extensive surgery. However, it didn't require replacing muscle or moving muscle or anything like that. It's a muscle sparing surgery. And she said, if I had to compare the two that I have, I prefer that versus the implant. She's like, the implant is cold. It doesn't feel natural. It doesn't feel like your body. And the flap, she's like, it's warm. It feels like me. It feels more natural. And so, unfortunately, she has one of each. That was not her plan. And, there were reasons that were beyond her control in terms of how she ended up with one of each. However, the fact that she ended up with one of each is kind of what helped me, seek another option, seek more education about breast reconstruction, now that I'm having to make a decision of my own. And so DIEP flap is what it was called. She's like, research it, look it up, and, at least know all your options before you, make a decision, so that you're able to make one that you can be satisfied with. And so thankfully, because of her, I was able to do that. So after that conversation, I had the opportunity to follow up, or not follow up, but I had an opportunity to research and find doctors in my state that are able to offer that type of breast reconstruction, because not all plastic surgeons offer DIEP flap reconstruction or natural breast reconstruction. And so I was able to find a doctor that is in Charleston, and I found one that's here in the Upstate. And so I, kind of had them at the top of my mind in terms of, okay, I'll reach out to them to schedule a consult at some point. In that mental process, I have a really close friend who's also like a sister to me, reach out to me to say that she has a family member who's also a survivor who actually had breast reconstruction that didn't involve taking muscle from anywhere. And so she's like, hey, I know you said you didn't want to do the flap. However, do you know it's another type of flap that doesn't take muscle? And I'm like, just recently found that out. And so I'm like, hey, do you think your cousin will, have a conversation with me so that I can pick her brain a little bit more? And so she's like, sure. So had a conversation with her, and, come to find out, she actually used a doctor that's in Charleston that I looked up and discovered. And so she had really great things to say about him, had really great things to say in terms of the results. Her only negative was the fact that she's not, she felt like she wasn't symmetrical yet. However, she has the opportunity to go back and get a revision done. She's only had one surgery so far. And so she's like, in terms of the process, you have an opportunity to go back and get revisions done. But ultimately, she felt 100%, satisfied in the decision of going natural reconstruction. So that was a plus. And so I took that information that was given, and, still was just kind of processing it, taking my time. And, as these weeks are going by and treatments are going by, I'm getting closer to the time of having to have the mastectomy surgery. And I'm still not, I still hadn't made a decision yet. And so my sis reaches out again and says, hey, what did you decide? And I'm like, well, I'm kind of leaning towards the DIEP flap. It's not 100%, but that's definitely more so what I would be wanting to consider, because I love the idea that it's not taking muscle. I love the idea that I wouldn't have to have any other surgeries later, 10, 20, 30 years down the road. And so, I'm more so leaning towards it for those reasons. And so she's like, hey, well, have you had a chance to speak with any of the surgeons that do it yet? And I'm like, no, I found them, but I haven't reached out yet. And she's like, girl, schedule the appointments. Schedule the appointment. So thankfully, because of her, I did schedule the appointments. I scheduled the appointment with both doctors, the one that's here in the upstate of South Carolina and the doctor that's in the low country Charleston area of South Carolina. And so I had the opportunity to meet with both of those doctors this week, and I'm glad I did. And so I'll start with Charleston because that's the doctor that I saw first. And so Dr. Craigie is his name. I have my notes here that I'll refer to, but the main thing to take away from his appointment was the fact that I am a candidate for DIEP flap surgery reconstruction. He, feels confident in terms of his success rates. He, said his surgery reconstruction has a 99% success rate, which is good. And then he went into, a lot of detail in terms of the surgery itself, the recovery, and just kind of how to plan and prepare for that type of surgery, because it is major surgery. Again, only special doctors do it. Not all plastic surgeons do it, because it requires them reconnecting nerves and blood vessels to make your body truly accept that tissue, from one location to the other. And so because it's such a, intricate type of surgery, there are only special plastic surgeons that do it, a lot of plastic surgeons that only focus on that. And so in terms of some of the things that was discussed, like I said, I really enjoyed meeting him. He's in the Mount Pleasant area of Charleston, South Carolina. And so, like I said, the main thing to take away was that I am a candidate for it. I can schedule that reconstruction surgery as early as 2 months after the mastectomy. So that was good to know. It doesn't have to be something that's like long and drawn out. His practice has done about 2,000 of those type of reconstruction surgery so far. His office does offer other type of reconstruction or plastic surgery options as well. But in terms of DIEP flap, they've done about 2,000 of those. Recovery, won't be able to drive for about 3 weeks. Plan for at least an 8-week recovery from it. They like to do an MRI of the abdomen before surgery to look at those vessels and nerves and everything in that region before they even take it. And so, I didn't say what it is. And so DIEP flap will be taking tissue and fat from my abdomen and putting it where the, breast would be, where you're going to remove the breast. I'm having a single mastectomy up front. And then my reconstruction is on the backside anyway. And so that will mean, I'll go in and I'll have the right breast that I'll want to have a mastectomy on as well. And so he said that would be no issue to do that at the time of reconstruction. He would coordinate with another breast surgeon in Charleston. And so that doctor will come in and essentially be doing the mastectomy while his team is doing, taking the skin and tissue from my abdomen and preparing to, put that tissue at the breast sites. And so it's a long surgery. He said it'll be about 7 hours. Of course, I won't be aware of how long it's taken because I will be under. He said the hardest part is really just for family members, because they're worried that whole time because it's such a long surgery, but it's such a, special detailed surgery that it takes that amount of time. And that was one of the things that, like I said, my friend who had a family member that just had it done, that was one of the things that she mentioned as well, that it's a long surgery. So he said it'd be about 7 hours, plan for about an 8-week recovery, the MRI. In terms of after, it's done, I have to stay in the hospital for about 3 days. They'll be monitoring me closely to make sure that my body or that the new site is accepting that tissue. And, it's just, recovery is tough, but it's doable. And so it will also include somewhat of a tummy tuck for me. So that's a plus. I mean, if you got to go under and go through all this, why not come on the other side with a nice snatched tummy? Hey, sign me up for it. But that's what makes the recovery harder because I will be recovering from 2 surgical sites, my breast, chest area, and my abdomen, because they literally cut you from hip to hip to take that skin and tissue. And it's the area that's under your belly button that they take. And so, the plus side, I probably get rid of, the stretch marks, won't have that excess fat there, and, hey, have some natural boobs. He did make a note to say that they won't be the same size that I currently am, which is totally fine. I've had breasts since I was in the 3rd grade. Of course, they weren't always as big in the 3rd grade, but, as I got older, they got bigger. And so I have always been full. And so the idea is, he's like, they'll be smaller. And he's like, in terms of cup size, he can't really say specifically, but, they're not going to be, D's, double D's, or whatever they are right now. And so I'm fine with that. Like, if I have an opportunity to just go out and not have to put on a bra at some point of my life, other than the first couple years when I didn't have boobs, I am for that. Sign me up for that because again, I remember getting breast buds in the 3rd grade. So the last time that I have gone around not needing to wear a bra has been a long time ago. That was in elementary school. And so, yeah, by middle school, I got boobs. I got real boobs. And so, yeah, let me go through with some small A's is what I imagine. I don't know that that's what they'll be, but that's what I imagine. I'm okay. Sign me up for that. I'll do that. It can't be, another thing that he mentioned is that it can't be done before radiation. They wouldn't recommend doing it before radiation if I need to have radiation as well once I have the mastectomy. Again, that is kind of like up in the air until surgery because they will do sentinel node biopsy then. If the sentinel nodes are negative, the radiation oncologist said up front, if they were negative, then more than likely I won't see him because I'm getting a mastectomy instead of a lumpectomy. And it was some other criteria that he mentioned that I may have mentioned, I think, before in the other video. But in terms of the reconstruction side, if radiation is required, they want that to happen first and then do the DIEP flap surgery. So, in terms of the timeline, I don't know quite when I will be able to schedule it yet, but that's, something to consider. And he said that he would speak with or need to speak with Dr. Allgood, which is my breast surgeon here, to discuss leaving some skin, because apparently that has, something to do with, it helps with the reconstruction process. Drains will be in for about 3 to 4 weeks. A lot of drains from my understanding because, again, I have multiple surgical sites. And so I think it's going to be like drains in the abdomen and drains in my chest to drain the breast sites. Have to take a blood thinner prior to surgery to prevent clots. I'll have on SCDs while I'm in surgery and post-op recovery as well. Again, it's a long surgery. I'll have scar on my abdomen, similar to a C-section scar, but a little bit more detailed because, again, they're kind of going from hip to hip instead of just focusing on the uterus area. Probably have to sleep upright for a couple of weeks, like in a recliner chair, while I recover. And he mentioned that revisions can be done. He said the first surgery is really to focus on getting that skin and tissue to be accepted, to make sure, there's no necrosis, no rejection pretty much there. And so they do that, they focus on that first and then come back to focus on, how it looks, making it look, perfect, so to speak. And so they may not be symmetric at first. It may not, look the best at first, but they're getting it to be accepted. And then he said they can go back and do revisions to, to tweak it, to make it look really cute. I don't imagine that I'll be on the cover of any type of magazine where I have to be nude, or, have to take any nude photos that the world have to see. So for me, it doesn't bother me. The idea of it not being symmetric doesn't bother me right now because as of right now, my boobs don't make money for me anyway. So, even after breast reconstruction, I don't imagine that they will be money makers for me. So, they're not symmetric. Okay, that's fine. As long as it's not one way up here and one way down there, I think I'll be okay. And so, yeah, it was a really great meeting with him. What I liked about him, his office is really quaint. It feels more like a living room. So you didn't feel like you were going to a doctor's office, so to speak. And I have footage to include from, that day and all of that. And so that, is in this video. Just continue to watch. And what else did I like about him? I like that he was extremely patient. So that consult probably was at least an hour long. That's why this video is a pretty lengthy video because I had that much information to share with you guys because he took the time to share all that information with me. So yeah, it was a really long consult, but I didn't feel rushed. I felt like I was priority that day, like he didn't have any other appointments. If he did, Who knows? I didn't know anything about it because he took the time to answer every single question, took the time to explain in lengthy detail, like I said, the surgery, the recovery, and all of that. These are just my notes, but there was a lot that was discussed, but these were like the main things that, I wrote down that I wanted to remember from that day. So very, very nice guy. I mean, nothing bad to say about that visit at all. And so that part, that's him. Then Thursday, I had the opportunity to meet with Dr. Orsick. Dr. Orsick is the plastic surgeon here in the Upstate area that offers deep flat reconstruction surgery. So, his office is within like a medical complex. So in terms of how it looks like a doctor's office. Met with him, seems to be a very great guy. Seems to be a, well-respected plastic surgeon in the area. So nothing negative there. The only thing I will say about him so far in terms of the first impression, he did not seem as patient as Dr. Orsick. He seemed a little more rushed in terms of like some of the questions that I was asking him. I would get we'll worry about that later. We'll talk about that later. Like, this is what we need to focus on right now. We'll talk about that later. I get that, but I'm a planner. I want to talk about it now because I want to plan for the future. And so that part for me wasn't necessarily my favorite. He also almost rubbed me the wrong way when he came in, because when I met with him, he wasn't in there at the beginning to take on like that first initial part of my visit. The nurse practitioner was. And so as she was asking questions, kind of getting caught up with, who I was and what I had gone on, he walked in on a part of the conversation where I said that, initially my surgery would just be a single mastectomy, and I would like to do the right breast when I have reconstruction. And he walked in during that part of the conversation and like immediately came in and was kind of like, what's going on? Like, no, like that does not need to happen that way. Let me refer you to a breast surgeon in our network, and we can do all that at one time, because everything can happen at one time. You don't have to wait. It doesn't have to be delayed and blah, blah, blah. Because that's what I was explaining. It's been recommended that I have delayed reconstruction and blah, blah, blah. But he like didn't let the whole conversation happen before he reacted. And it was kind of like, calm down a minute. The reason that they're suggesting this is because I may need radiation. They don't know yet. And then he was like, oh, okay. I'm sorry. Well, disregard all that. If you need radiation, then we can't do anything until after that happens. And I'm like, yeah, that's what I was trying to get to with the conversation. That's, I've understood that. And let me bring you up to speed first before you react. So, so for that part, just kind of like, I don't know. Now, I just don't know. I know between the two, the doctor in Charleston has done more of these procedures, and he, has a partner that does it with him, from my understanding, from the doctor here in the Upstate area. I think it's just him that does that. So I don't know if that would make a difference in terms of my decision. But yeah, so that's that update. In terms of leaving out of there, I did find out from him as well that, again, I am a candidate for it. He kind of echoed the same thing as the doctor in Charleston in terms of they won't be the same size. They will be smaller, which again, I am totally okay with that. A lot of the information, in terms of the information I did get from him, it lined up with, what I had already heard from the doctor in Charleston. So that was good to know. They didn't have too much of a difference in terms of what they were able to do, what they expected the outcome to be, and that kind of thing. But like I said, with him, he was not as patient, was not as detailed. If you ask Cedric is like, in terms of a personality or disc profile assessment, he was like, he seems to be a high D, a driver, which is totally fine because I have a lot of D on my personality trait scale as well. But when it comes to my care personally and what I receive from providers, I do realize that I appreciate providers that are a little bit more patient with me, because even though I'm in healthcare And I understand all this terminology and, the way things will go. When it's me personally, I prefer a more patient provider with me, because I think my brain is going like, 1,000 miles per minute. And just to have someone that can like slow it down a little bit for me, just to make sure that I am processing everything right, is important. Because just because I know and I'm familiar doesn't mean that I'm receiving it the way that I should. And so I'm torn. I'm torn a little. However, I will say this. Just a little bit ago, like I was talking to someone about it, and as I'm talking to them about it, saying like these same things that I'm expressing right now, I was sharing how I'm kind of, torn between making that decision, yada, yada, yada. And I realized I missed a call from my sister that has been through this. And so I call her back, and she's like, hey, what's the doctor's name in Charleston that you met with again? And I was like, oh, Dr. Craigie. And I hear, a person join the call, and they're like, yeah, that was my doctor. And so I'm like, what you have going on? What's going on? And so she just happened to be at the gym that day and saw someone that she normally sees a lot. It's not the first time that she's seen this person, but she saw this woman who she's seen a lot. And for whatever reason, this particular day, she realizes that this woman is probably a breast cancer survivor as well. And so she takes it upon herself to have a conversation with her about it, and, discovers a whole lot of stuff, like a whole lot of information in terms of how similar their things were in terms of what they received in surgeries and all that. And in the midst of all that, talking about natural breast reconstruction, this woman says she had hers done in South Carolina versus Georgia because of, whatever reason she couldn't get it done in Georgia. And so, she was calling me to make sure like, hey, you need to meet with this doctor, talk to this doctor that this woman used. And it happened to be the same doctor that I had already had a consult with. So it was good, because now I have a second person that has used this doctor, and she had really great things to say about him as well, really great things to say about his office. And she felt, pretty much satisfied with the surgery as well. And her complaint was the same complaint as the other person, in terms of she didn't feel like she was symmetric. It didn't look how she wanted it to look yet. And so, ultimately for me, that's not a big deal. Again, as I'm thinking right now, it may be a big deal later, but for right now, I think my main thing is I wanted to make sure that it's a successful surgery, and that my body doesn't reject the donor tissue, because that's a whole nother nightmare if you don't have, the skin and the fat to move because your body doesn't want it, versus it's there and we just want to make sure that they are equally balanced. So it was good, again, to hear that come from someone else that, was his patient. She did also share that she had an opportunity to have a consult in San Antonio as well, through a practice that does more of these surgeries, a whole lot more of these surgeries. And so she dropped that nugget for me to at least research them. And if I can in any way make it happen to where I'm able to have that surgery done in San Antonio versus here locally, that I need to consider it. And my sister kind of echoed that as well, that she remembers researching that facility, and they did have a whole lot more, experience and reviews and all that behind it, because this was like the well-renowned center, in the United States that does these surgeries. And so they both kind of said, well, yeah, if you have the opportunity to research it, look into it, then it's worth it. As you can imagine, I live on the East Coast, so to be able to go out to Texas, and then now knowing that I'll have to be in the hospital for 3 days, and, you have to have follow-up appointments with your surgeons and things like that. I don't know how I would make it happen, because I feel like that's kind of like one of the things that I'm weighing as well when I'm trying to make the decision now, even here locally in South Carolina. Do I choose the Upstate doctor, or do I choose the Low Country doctor? One doctor is 30 minutes, one hospital is 30 minutes down the road. The other hospital is 3 hours down the road. And so how does that work in terms of arranging things for my children and the logistics of everything? Family we'll have to get a house to rent down there if I decide to have everyone travel with me. It's just little thoughts like that will play into that decision a little bit. And so the idea of going out to Texas to get it done, it kind of like makes me a little anxious. I love the idea of knowing that it is a center out there that's even better than what I've met so far, just based off of the information that I received from them. But again, trying to make it work kind of, makes me a little anxious. So who knows? Like I said, the main takeaway is DIEP flap, and I'm holding this because this was, just like a little information brochure that I was given about the DIEP flap, reconstruction, the natural breast reconstruction. And so again, the main takeaway is that I want it done. I don't feel like I'm torn between being flat or going with this route, like I was with being flat and going with the implant route, because the main thing is this will be outside of any type of revision. This will be the only surgery that I'll need. And so, when I'm 80, 90 years old, I'm not going back to replace, boobs. And who's to say, at 80 and 90 that I would even care to replace it at that point. But to get to 80 and 90, I still got, 40s, 50s, 60s, 70s there, are points of my life that I may want to have boobs. And so to have to keep replacing an implant that amount of time, it just seems like it's a lot. It's a lot. So with this option, won't have to do it. You get it done that one time. You get it to look how you want it done, and you get your nipple tattooed on. They can do 3D tattooed nipples, and there's another type of nipple option. I can't remember what he said right now. I didn't write it down because that wasn't really important to me at the time. But it's just really good to have another option now that I feel like definitely fits more into what I would like done. Yes, it is a longer recovery. Yes, it is a longer surgery, but having one long surgery and recovery versus multiple later down the road, I think is more in favor, or more favorable for me, more of what I would like to have done. So wanted to provide that update. And again, I will include our adventure driving to Charleston, South Carolina to meet with the doctor and everything else in between. Just in case anybody wanted to know, Matea went with me. She went to the appointment, and of course Cedric was there as well. A plus that has nothing to do with any of this is if I do have it in Charleston, I am going to eat good, because that's the low country and it's right by the water with all the good seafood. We had lunch at a restaurant down there that I already realized that if we come back down, that's where I want to have lunch. So that's a plus. That might tip the scale. It's already tipped, and it's leaning real heavy to Charleston. So when you add food and beach and recovery and all that, I don't know. I'll update you guys when I know. I'll definitely let you know who I decide. But until then, that's where we're leaning. But what I was going to say is, yes, Matea was there, and Matea does not need to come to any more appointments because Matea was a bad girl. But again, going back to how patient the doctor was, even in all of that mix of, she's mixing up, doing everything, he was still able to remain calm and do the consultation as if it was no distraction in the room. So I appreciated that as well. All right, so that's all I had. Thank you for watching. Thank you for following the journey. Like, comment, hit the subscription button, turn on your notification, because I'm still, I got more to share, and I want to share it with you guys. So thank you.
That seems like it's from the thing too. This was playing now. Just left an appointment here. Woo-woo.